95,000 cases globally, 3,249 deaths, and 6 African countries confirm positive diagnosis. Yes, that's the coronavirus, potentially the biggest story worldwide, not only affecting homes, but economies too. Good evening and welcome to African Perspective. I'm Aldrin St-Pierre. It goes without saying that tonight all you have to know about the coronavirus. Should we panic? South Africa's Health Acting DG, Dr. Aben Pillay, will answer that. And remember that we'd love to hear your perspective as well. You can send us your questions and comments to @AfricanSpec1 on Twitter. Travel disruptions due to the outbreak of COVID-19 has caused a 10% decline in traveller bookings this month, up from last month, according to Kenya's Association of Travel Agents. This follows cancellations of bookings as major meetings in several cities and countries scramble to control the spread of the disease, the coronavirus that is. It's currently affecting 81 countries and has claimed over 3,000 lives and 100 lives, Sarakimani reports.
Counting the cost of the deadly coronavirus whose global spread has caused fear.
The coronavirus has caused unprecedented disruption in the aviation and travel industry, leading to cancellation of flights and rescheduling of passengers who travel in recent months. We have also observed a cancellation of major conventions and events in major cities, leading to major decline in passenger numbers and revenue for both the travel agents and the airlines.
Just this week, 15 Kenyan members of parliament joined a list of over 12,000 delegates from across the world who have had to cancel their travel plans to New York after the United Nations cancelled this year's celebrations to mark 25 years since the Beijing Conference on Women. This just one of the many cancellations whose effect is now beginning to have an impact on Kenya's travel sector as well as the economy.
Early indications show that there was a decline of 6% in travel bookings for February and 10% to date in March. We are expecting this number to continue to increase in short term as travel restrictions come in to effect to key markets this nation, as witnessed in China, South Korea, Iran, Saudi Arabia and Italy. Governments, corporates, NGOs, and traders and travelers in general are currently reconsidering non-essential travel globally, hence impacting on the above intercontinental travel. However, intra-Africa travel appears to remain stable. I believe this is because there's been no reported fatalities in Africa. We anticipate that the travel restriction and advisory to be temporary measure to help contain the novel coronavirus.
Kenya's multi-billion shillings tourism industry is also expected to feel the heat as the country took measures to cushion itself from the spread of the disease, cancelling flights from China and Italy, two of the country's source markets for tourists. No East African nation has a confirmed case of COVID-19. Sarah Kimani, SABC News, Kenya.
Meanwhile, the Government Communications and Information System says that 2 South African crew members aboard the passenger cruise liner docked at Yokohama in Japan have recovered from the coronavirus and are expected to return home soon. 10 other South African crew members tested negative. The GCIS says the family members who require more information are encouraged to contact the International Relations. And in other developments, government says last week that 184 South Africans out of the 201 living in China's city Wuhan at the epicenter of the coronavirus had indicated their intention to return home. They'll be kept in quarantine for 3 weeks as a precaution when they arrive home. Health Minister Zweli Mkhize earlier on briefed Parliament on the repatriation process.
In South Africa, we have estimated about 3,000 people in different parts of China, and therefore the concern was a large number of students and teachers who are in the Hebei province and Wuhan city. At the beginning of the epidemic or the outbreak, we did contact them. It was not easy to do so, but we contacted them, and a number of them. On the first week, we had actually contacted the first 34 people, and they were not interested in coming back. About 33 said no. Then one said yes, they would come back. Then we then improved the contact and we went around talking to people. With the quarantine and lockdown continuing, the numbers have increased. And that's as a result, when we had about 130 people and we spoke to them and a majority wanted to come back, we then took a decision as cabinet that we need to get them to be brought back. We're working on this issue, although the number has increased now to 151. And so we're making preparations for them to be brought back.
Well, for more on this, we now go live to our Pretoria studio. We'll be joined by the Acting Health DG, Dr. Anben Pillay, who joins us from our Pretoria studios. Dr. Anben Pillay, good evening and welcome to the African Perspective. Let's start off here looking at the numbers and how the numbers are increasing globally, positive diagnosis as well. As South Africans, should we be panicking?
No, I don't think there's a need for panic in South Africa yet. We don't have any cases in South Africa. We have a good preparedness strategy in place. We have a good laboratory at the NICD that's able to diagnose cases. So I think that we're currently in a very good space to respond to any potential coronavirus outbreak in South Africa.
Okay, in a few minutes, I'll probably come back to you with some of the concerns that have been raised by certain quarters in the medical fraternity, including the South African Medical Associations. But let's start off here from the statement that was released earlier on by the GCIS, also confirming that an aircraft has been procured. Can you confirm whether that aircraft has left the country as yet?
No, the aircraft hasn't left the country as yet. We need to finalize the numbers on the Chinese side so that when the aircraft does leave, we know exactly who it is that's coming along, and anybody who's not part of the list will then not be able to be on the aircraft. So we need to finalize that before we actually let the aircraft go.
What has led to this delay? Because expectations were that within 7 days at least that the aircraft would have left.
Well, the aircraft is going directly into China, so the aircraft can go at any time. We had indicated on Sunday that within 10 days we would have done this. So we're giving people time in China to actually respond to us. So some people had not got the message that we're coming in to repatriate them. So we need to give them some time to respond and for them to make the logistical arrangements to get to the airport in Wuhan so that we're able to repatriate them.
How are you trying to get that message across to them?
So the embassy in Beijing and Shanghai are working very hard to contact all of the potential students that are there. I think one of the challenges we have is that South Africans, when they are abroad, they don't register with the embassy. And so the embassy doesn't have the contact details of everyone and where they're living, etc. And so we're relying on the social circles to identify people that may not be aware.
Mm-hmm. Of the 185 who have confirmed their intention to be repatriated, can you confirm whether or not they have been diagnosed or showing any symptoms of high fever?
None of them have indicated that they've been diagnosed with the coronavirus. In addition to that, I should add that before they come on the flight, they will be screened and assessed by us. So we will confirm that they are actually asymptomatic, and we would assume that they are free of the infection at the point of entering the aircraft.
Sure.
Yes.
And what about the crew members who are supposed to work on board the aircraft? Have they been secured?
Yes, so the crew members have been secured, and that the aircraft carrier will provide, as well as the pilots, yes.
Mm-hmm. In the statement that was issued earlier on as well, there is a line that indicates that service providers have been intimidated. Can you explain what this means? Intimidation coming from where, or is it that they are scared?
Well, I think there's a lot of general hate speech going around that those South Africans that are in China should not return. They're going to cause a lot of harm and spread the disease here, etc. I think South Africans need to understand that these people are not infected with the disease, and secondly, they'll be coming back into a quarantine area, and they'll not be mingling with the South Africans freely to spread the disease, even if they had it. So we're taking all those precautions to make make sure that this doesn't spread to other South Africans that are here currently.
And where would they be quarantined?
They'll be quarantined at a site that will be able to accommodate all of them, that is secure, and will not have any interaction with the general public as such.
Has the site been secured as yet?
Well, we haven't finalized some of the key issues on the site, and we're busy doing that currently.
Is that not the reason why there's a delay in trying to repatriate these 184 South Africans who are in Wuhan? That in actual fact,
No,
the health department, as well as the net joint, does not have everything in place to ensure that once the aircraft comes back, that the site has been secured. So right now we know that the site has not been secured as yet.
Well, we were working on securing the site, but that's not the reason why the aircraft hasn't left. As I said, you have to ensure that all South Africans are aware and they made arrangements. The aircraft has to get approvals for overfly rights, landing rights. The crew has to get approval for travel, etc. So there are a lot of other approvals that have to be in place before the aircraft actually leaves.
And how soon would you be able to secure this particular site? Is there specific places that government is currently looking into?
So the South African military is going to be key, because they're going to be securing the site. They identified 84 sites that are potential options, and we're pursuing those to finalize a site that we would be able to use.
Are these medical centers?
No. Because these South Africans that are coming back are not ill, so they don't need to be in medical centers. They would be at a place that would be similar to a lodge or an inn or a hotel, where they would be able to stay for the period of the quarantine, and hopefully they would all be asymptomatic and disease-free at the end of the 21 days, and they can be released. But if they obviously manifest any signs of the disease and that's confirmed, they'll then be put into isolation, and if they require hospitalization, we'll then move them to such a facility.
And that's the other concern, right, is that you have the 184, or whether this number would increase, is that once they come back to the country and they are in one space, and you may just find that there could be one of the South Africans who have been repatriated who may be infected and only start showing symptoms at a later stage. Is that not a risk?
Yes, it is the risk, and we will manage that risk by making sure that when the South Africans return and they're in the quarantine space, that they maintain what we call social distancing, so that they're not interacting closely with each other, where if any particular individual is infected and we haven't detected that as yet, and maybe spreading the organism, that person is not in contact with other people. Many countries have implemented this type of social distancing in the quarantine to prevent spread even during the quarantine period in a limited setting.
Sure. And finally, on the statement as well, also we see that the 2 South Africans who were on board the cruise ship have now been tested negative. Initially, they were tested positive. Just from a medical perspective, can you please explain to us how this would happen?
Well, remember that the organism, when you are infected with it, the detection is by taking a swab in the pharynx and identifying the organism in laboratory tests. So that's the mechanism that's used. Now, the organism doesn't always manifest immediately in the pharynx, and then when it does, the body would be able to respond to the organism and fight it off like your normal healthy immune system should. And so then you would find that the organism would no longer be present. So that's normally what would happen in such a case.
Okay, and chances of the body lapsing again, that's quite slim.
That's usually very slim. I think I've only heard of one case where a person relapsed back into infection after being well for a period of time.
Okay, then thank you so much. Dr. Anban Pillay will continue the conversation just after this. We're going to take a quick break. When we come back, we'll also be looking into some of the mechanisms that the country has put in place to ensure that our borders are also secured and make sure that the coronavirus does not spread in this country. And very good evening. You're still watching African Perspective with me, Aldrin St-Pierre. We're currently in conversation with Dr. Anban Pillay, who's the Acting Director General at the Department of Health. And we have some breaking news that has just come through as well, that in Algeria, the number of confirmed cases, which initially stood at 3, have now increased to 9. We also hear from the World Health Organization as well that there is a shortages of masks globally. And let me ask Dr. Anban Pillay on this particular aspect. When it comes to the issue of masks, how is South Africa doing?
We've checked the mask situation that in the country. So all of our facilities that will be managing the coronavirus, the 13 hospitals across the country, they all have masks, gloves, as well as the personal protective equipment that's required to manage this condition. So we're in a good space currently on masks, gloves, and what we call the PPE equipment, yes.
Do we know from a retailer's perspective where we're standing in terms of stockpile?
I think if you go into your private pharmacy and the like, you may not find masks and gloves because people have been buying a lot of these, stockpiling them, and those that are planning to travel are using them for travel, etc. So I think in your retail pharmacy you may not find them, but obviously government, who is a huge purchaser, is able to secure these quantities from manufacturers. There are a few local South African manufacturers as well, so they're continuing to produce. As well.
What would your advice be to a South African right now who actually wants a mask?
Well, the question would be, why would you need a mask currently in South Africa? I can understand why if you're in China you need a mask, but in the South African context, we currently don't have anyone who is a coronavirus positive, so the risk of you actually contracting it currently is very low. I would understand if we had an outbreak and there are quite a few people walking around that may be infected, and then you'd want to wear a mask, but at this stage I don't see the value. I'm not using a mask, for example, and I don't see the value in doing so.
But for people who are traveling, because I see as well that the department has taken the decision, or government has taken the decision, not to cancel any major events that will be taking place in the country.
Yeah, at this stage we've not cancelled any events. I think this was a discussion point as well in Parliament, and we've indicated that this is something that we are monitoring, and we will be looking at the developments globally as well as in South Africa, and may have to revisit the decision at some point if necessary. But at this point we're not stopping any major events. No.
And why is that?
Well, currently we don't have a epidemic in South Africa.
Sure.
There are no patients, and so there's the need to actually stop an event is questionable.
Shouldn't the government be erring on the side of caution, considering that major events, of course, attract people who would be coming from various countries as well?
Well, we're screening everyone that's coming from those major countries, and we're also evaluating those that are high risk. So your countries such as China, Italy, France, etc., Vietnam, so that we get a good sense about their risk profile before we allow them into the country. So we're doing that, and we have the good fortune that the NICD is able to support us in doing that. So I think at this stage we're able to regulate that issue quite well.
Yeah, and how do you deal with it when the argument from some in the medical fraternity is that the disease could lie dormant for a while, and only after about 14 days would you know whether the person has been infected or not. So what happens at a port of entry that can confirm and guarantee that this person has no coronavirus which could be lying dormant during the time of making their way through our ports of entry?
Well, those that are coming from countries that are high risk also complete a questionnaire where we assess where they're coming from and what context they've had. And they also share with us where they're going to be in South Africa, what they're going to be doing, etc. So we're able to trace them at any point in time if we need to. So we have that in place as well. But I think the risk that we have of somebody coming into the country with coronavirus positive is the same as a South African who's returning from another country on a visit. It's the same risk, yes.
Sure. Okay. And the concern that was raised by the South African Medical Association was around the border posts. And we here at the SABC also carried a story where, for instance, at the Beitbridge border post, people who were making their way through the border post said that they weren't being screened at all.
Now, I think that incident happened only for a couple of hours because staff members in the morning shift had fallen ill and had not pitched up for work. And so we had to then get in alternative staff. So that happened for a very short period of time in the morning, and we were able to get staff in by the afternoon. So I think it's not as if it's every day that this happened. This happened just for a short while on a particular day.
All of them fell ill?
Well, 3 staff members fell ill, yes.
All at the same time?
Yes.
And there was no one at the border post?
Yes, there was only the manager at the border post, and then when she alerted us to this problem, we then had to deploy additional staff.
Sure. So how sure are we that during that period we may not have had someone who may have made their way through the border post and may be carrying the coronavirus?
Well, I mean, obviously that's a risk in that period. That could have happened, yes.
Are we tracking down who those people are who would have made their way through into the country during that window?
So we've requested Home Affairs to give us information about those individuals so we can try and trace where they are, who they are that came through the border to understand a little bit better about what profile we're dealing with in terms of risk.
Okay, let's quickly speak about the cooperation I'd like to believe that South Africa has with countries, neighboring countries, including member states of SADC. What is that cooperation, if at all there is cooperation between the health ministries?
So there's information sharing around how we're managing the coronavirus outbreaks in each country, how we're doing the assessments, the surveillance. And South Africa obviously is a reference laboratory, so reference testing is done at the NICD, and many of the NICD scientists serve as an advisory role in many of these countries in terms of supporting them in making decisions around how they deal with this.
Sure. Is there any concern that has been expressed by any of them, including the South African government, considering that you have what's happening now north of the continent? We just said now that in Algeria, for instance, that the number of confirmed cases have increased from 3 to 6, and we have 5 other countries that have also confirmed coronavirus cases.
Yes, I think many countries in Africa are concerned, obviously, that they remain vulnerable to being infected. And recently there was an AU meeting where this was discussed, and many African ministers expressed their concern. And there was a discussion of what measures can be put in place for surveillance, because that's the best that can be done at this stage to make sure you isolate and identify those individuals that may be infected.
I would imagine that money as well plays quite a crucial role in this and trying to prevent the spread of the virus as well. And listening into the Deputy Finance Minister yesterday, Dr. David Masondo, saying that, of course, the country didn't budget for something like this. The outbreak was only detected last year, December, in Wuhan. So it was not part of South Africa's budget plans. Are there any plans now to increase the budget, and how that budget would be increased?
So when we have an outbreak of this nature, we would usually use funds on an emergency basis, and there is a disaster fund that the National Treasury manages, and we would then request to use funding from the disaster fund after spending our funds, obviously. So at this stage, we will prioritize funding for this outbreak and manage it as such.
But are we okay financially for now?
Yes, we're fine financially. We will have to deal with this, yes.
And the economy as well. We've seen what's happening in the markets, for instance, and how the markets have reacted to the coronavirus. We've seen that also tourism has also been impacted. What mechanisms have South Africa put in place, from the department's side at least, to help those in the tourism sector to ensure that they are not knocked that hard by this coronavirus?
Well, we remain without infection, and so the best thing that our tourism industry can share with those that potentially consider South Africa as a destination is that we're at much lower risk than many of the other countries, and we're currently going through a summer, so it would be the best opportunity to actually visit South Africa. There are a general decline in numbers of air travel because people are just scared of traveling because of the risk of contracting the organism. So I think that's a global trend which it will be difficult for South Africa to turn around.
And the message to social partners, whether it is business, whether it is schools, for instance, and NGOs, in terms of trying to spread the message around the coronavirus and understanding of the coronavirus as well?
I think the important message that everyone needs to appreciate is that the key thing is to prevent getting infected, and that is by observing good hygiene practices. In other words, maybe you don't want to shake people's hand in future, don't touch doorknobs, but try to open the door without grasping onto the doorknob, and not being in large crowds. When you cough, make sure that you use appropriate protection so that you don't spray droplets into the air that may infect other persons. So those kinds of personal hygiene practices, I think, are critical. So is good hand sanitizer being available in key places so that everyone can use that. I think that's a critical aspect of preventing the spread of the organism.
But is government actively taking this campaign to these schools, to churches as well? We've seen now the CDC in the United States, for instance, has called on churches as well to play a role, and some churches have decided to suspend services and told some of its congregants not to attend Mass.
Yes, we've shared a lot of this information. I think we can probably do a lot more around trying to share the information. I suppose the key issue is the message getting to those who most need to hear about it, and we'll continue to communicate using the various media. On our website is a lot of information which we're trying to share in other platforms as well, and hopefully that message will get to ordinary South Africans so they will understand how they need to behave in this period.
Dr. Anban Pillay, thank you so much for your time. That is the Acting Health Director General in the Department of Health. We go to a quick ad break. When we come back, the focus still continues on the coronavirus. While Africa is better prepared to deal with the ongoing COVID-19 outbreak should the epidemic cross the borders into more countries. That's according to the World Health Organization's Regional Director for Africa, Dr. Matshidiso Moeti. Dr. Moeti says the continent now has more laboratories with the capacity to diagnose the disease, and thousands of health personnel have been trained on surveillance, isolation, and appropriate treatment to those affected.
We have a strategic response plan that WHO at the global level has developed in consultation with some of the key partners that work on outbreaks of this nature. And what we're going to do now is look at the different elements of action within this plan. So, for example, we have surveillance. We need to build a laboratory diagnostic capacity in countries. They need to be able to manage cases when people fall ill in certain ways so as to contain the spread of the infection while the care that's provided saves people's lives. We do point of entry screening. And so we have partners like the International Organization for Migration that are very much involved in that work in the Ebola outbreak response, for example, where we are basically going to come to agreement who is going to do what, how are we going to coordinate our action so that we leverage the capacities of all these agencies in support of countries.
Well, initially when the disease broke out in China, it seemed very far, and there was even talk of when it finally lands in Africa, and it looked like it was never going to get here. Now it is here, but is the continent really prepared?
The continent is working very hard to be prepared. The ministers of health are working extremely hard. There have been several meetings, not only at the political level, but at the technical level. For example, one of the examples that show this level of effort is around having diagnostic capacity. About a month ago, only 2 laboratories, one in South Africa and the other one in Senegal, were capable of diagnosing this virus. Within a couple of weeks, that number had grown to 20 odd, and now currently we have 33 countries that have established the capacity for diagnosing. And I'm expecting within a week and a half to 2 weeks that all 47 member states will be able to do this. So that shows the level of effort, the intensity of work that has taken place in order to build capacity, not only in the laboratory area, but in the other aspects of confronting, containing, detecting, and then managing this outbreak if eventually there are cases in countries.
Are the isolation facilities that have been used for previous, outbreaks still the same that can be used for COVID-19, or are African countries having to, re-equip and make the ones that are available to be able to cope with this? And does the continent even have enough isolation facilities?
Well, isolation facilities, I think what you need to do is to designate a health facility, a clinic, a hospital, or a particular ward within a health facility as the isolation facility. And yes, it needs to be, if you like, purpose adapted for this respiratory infection. For example, we need to make sure that the flow of air through this building does not facilitate the spread of the virus to other surrounding areas, to other people who may be in the vicinity, for example. So it needs to be done in a specific way, so as to be a real containment and isolation of the risk of spread of the infection. And countries are working on this even as we speak. They're designating mostly existing health facilities which are needing to be adapted. Was
there fear about African countries not being prepared or not being well equipped to handle such an outbreak founded? And considering we've had outbreaks like Ebola, are there lessons that we can draw from that we can use now in COVID-19?
In fact, the Ebola preparedness investment in countries has been a positive in improving rapidly the preparedness of our member states, because we have been working on this with countries at risk for a year and a half. This Ebola outbreak has lasted quite a long time. And for example, the point of entry screening had been established very much with the Ebola outbreak in mind, and now we're just able to use it and adapt it for this illness. Certainly, there was justification to be concerned, because in our countries, if you look at an index of the functionality of health systems and even the outcome of the assessment of the international health regulations, yes, we do have gaps in African countries, and that is a cause for concern. But what is good is that with the support of partners and with the determination of governments, we are working very hard now to cover those gaps.
You had spoken about cost, and we know the WHO had actually asked for money. Do we have enough money as a continent now to be able to, deal with the issues that must be dealt with?
No, not yet. And I have to say, not only the African continent, but WHO and partners have developed together a plan, and we are now engaged in the process of dialogue with donors to support the plan. I have to say that the response has been positive. I'm not able to say the exact figures, but several of the international partners have indicated a willingness to support, to support not only countries in general, but some with a particular emphasis on supporting African countries. We do expect and hope that there will also be domestic allocation of resources to this work in the country. So we really need, if you like, that solidarity from the international community to build on the decisions that will be made by our countries themselves to invest in this preparedness.
And finally, what does this tell us about investments in public health, and especially for Africa?
it just serves to emphasize its importance, in my view, and in our view in WHO. So I'm very hopeful that coming out of the recent UN General Assembly high-level session on universal health coverage, where heads of state had a discussion and they made certain commitments to working towards and investing in universal health coverage, that this will deliver as well for the capacities to be prepared for outbreaks and emergencies and epidemics. Because when you are working on improving your health system, you're not only thinking about being able to immunize children or being able to make sure that people with HIV have access to treatment or people with malaria are treated. But we need to take into account very much the risk of outbreaks, and we need to take an evidence-based approach. That was done by WHO through carrying out joint external evaluations of all our member states in relation to the international health regulations, meaning their capacity to quickly detect, diagnose, contain an outbreak. So investing in health systems, I strongly believe, where we take into account the needs of outbreaks is one sure way to make sure that the next time the countries are in a better situation to be prepared.
In the era of social media, how can governments stay a step ahead of fake news?
They need to invest in disseminating the right information to people at different levels. At the end of the day, you know, people need to receive information from those that they trust. So we need to work at the community level, which we are doing, which we are starting to do, at the community level, on radio, through the social media, and also to make sure that the misinformation that can so easily spread through social media doesn't get out. WHO agreed with those who are managing social media platforms around this COVID outbreak to make sure that when a person clicks in to look for information, they are also directed to the WHO information that is then correct information. And we very much appreciate that partnership from these platform managers.
Well, Sarah Kimani also spoke to the Africa CDC that says that the continent has trained enough personnel to deal with the surveillance and to prevent new infections.
Africa is getting better and better prepared every day. As Africa CDC and the Africa Union, we have been building capacity across the continent to ensure that we are able to enhance our surveillance, and that means we pick out possible cases very early. We diagnose them rapidly. Within 3 or 4 hours, we have the results, and we contain any case that may have been identified. And this is what has happened in Egypt, in Algeria, and in Nigeria. In terms of the general preparedness of the continent, we are quite confident that the capacity building we've been doing for the last 3 weeks is having a very positive effect. Countries, governments, and our partners, we are getting more confident that we will not be surprised by community transmission. We will be picking these cases at the points of entry. Our health systems in Africa are very fragile, and we are very aware of this. That is why we are strengthening infection prevention and control, so that if a case is identified, we have them quickly isolated, and we can be able to manage those cases under an environment that does not allow for further transmission. So within our resources, I would say that we are as prepared as we can be, and we'll continue to prepare better. We will continue to build our capacity, and we will continue to improve the way and the speed at which we will respond.
Speaking about resources, when we first heard about the disease, countries that had fears that they actually had cases had to either send their specimens to South Africa or Senegal. Why was that, and is that what is still happening?
The reason why in the beginning there were only 2 laboratories in Africa that could be able to effectively diagnose in the laboratory this new coronavirus is because it is a new virus. And therefore the capacity to quickly be able to generate the assays that are required to do the testing required a certain level of expertise that was only available in these 2 labs, because they managed to get their own primers in place. Today, over 40 countries can be able to diagnose the new coronavirus within hours. So from 2, we are at 40 plus. This means that even the countries that do not have capacity at the moment, we are generally about 90 minutes by flight away from the nearest laboratory. But most of African countries can now be able to diagnose in the laboratory this new virus.
Take us through an isolation facility, what they are calling isolation facilities. What is needed there, and have you trained personnel that can now sit in those facilities and actually be able to monitor a patient round the clock?
Now, an isolation facility is a special facility where an individual who has been confirmed to be unwell needs to be looked after. These facilities are such that the air inside does not get outside. And when the air gets outside, it is cleaned so that it is free of the virus. These facilities are such that they are easy to clean and they have access to all the required equipment that is necessary to look after a very ill patient. Now, we have a wide range of patients. The vast majority are not very ill. And only a few, about 14%, will get very ill. But the isolation facility is designed to be able to look after the not so ill and the very ill patients as well. What we have done with governments, particularly in the hubs, the travel hubs, where most of air traffic in Africa is connected through, we have worked with those governments, including here in Nairobi, to identify where those isolation facilities will be placed, so that if an individual is identified and needs to be managed, then they are quickly transferred to the isolation facility, and in that contained and controlled environment, they can be able to be managed, and the rest of the public is then kept safe. Having said that, we are not clear where the next case will come from, simply because initially it was only China where there was the epicenter of the outbreak, but now we have multiple places around the world, and with the current air travel patterns, it could come from anywhere because people travel around the world. For this reason, we have done 3 things. One is trained countries, and now we are at about 23 countries, as I said, the hubs, where we have trained them in enhanced surveillance and events-based surveillance. So they are very good at picking out possible cases. The second is infection prevention and control. The health workers who would be the first ones to identify and manage such cases have been trained. Protocols are in place on what they need to do and how fast they need to do it. And the third is we have an emergency response team that is 24/7 ready. If something happens in a particular country and that country does not have adequate human resources, then we send these rapid responders. And that is what we've done with Nigeria because Algeria and Egypt had enough capacity at the time. So in terms of picking and isolating these particular individuals, all those hubs have adequate capacity. Let me add that there's a very big difference between isolation and quarantine. Quarantine is for individuals who have come from areas that have coronavirus, the new coronavirus, but they are not unwell. So we quarantine them to check if they may be able to get symptoms or not. But isolation is for those who are unwell, whether we have confirmed or otherwise. Those who are unwell, we keep them in isolation so the risk of spread is reduced. And at the same time, we then go ahead and do the laboratory testing. If they are confirmed to have, we keep them in the isolation facility for management. If they are confirmed not to have the virus, then they are managed like any other flu.
2 final questions. One, the continent seems to have been spared. When you look at how it has spread, Africa seems to have been the last one. And people are asking, how is it that, we saw Ebola and we saw how it spread very fast across the West African region. But with coronavirus, the continent seems to have been spared.
I would not want to worry why we don't have it. I would want to worry are we prepared in case it comes? It's already on the continent, and all the 3 cases have been imported from elsewhere. The possible reasons why Africa has been relatively spared is because where it started, that is in China, and particularly the Wuhan province, there was not so much direct travel between that province and Africa. It was always going through somewhere else. Nevertheless, what I would say is we are very awake, and our surveillance systems are enhanced, and in case anything will come from the epicenters around the world, then we will be ready to pick it out. And I think for Africa, what I would say is we should not panic, because panic is what is going to cause the most damage. We should prepare instead. And at Africa CDC, we are doing that with the governments around the continent.
And finally, very controversial, should we still allow flights from China, for example, into the continent?
I will start by saying that when Ebola hit West Africa, we as Africans said we should not stop travel, because by stopping travel, you affect economic activities. Indeed, you affect the ability of external resources to come into the area where there is a problem. In terms of, from the public health angle, so long as our surveillance is good, then we can be able to pick any case that comes. The decision whether to stop flights or not to stop flights, this is a national decision. And we, as Africa CDC, have provided very clear protocols on what to do at the surveillance level, because issues around whether flights should come or should not come is not our mandate. But we have provided governments with very clear protocols on what to do at ports of entry. And we are working very closely with the Chinese government, particularly the Chinese CDC, so that there is screening at the port of exit in China, and they are being screened so that when they are getting onto that flight, there is relative confidence that they are not unwell. When they arrive in Africa and all ports of entry where we still have flights coming in directly, they are also being screened so that we are relatively confident that they are not unwell. And if you see the cases that have been so far confirmed on the African continent, they are largely from Europe. Yes. And the very first one that was seen in Egypt was a traveler who came before the surveillance had been enhanced, because we did not know that the virus had hit the world. So in this way, I would say that disrupting the whole lifestyle may be counterproductive, but being prepared is the best way of addressing this current outbreak.
Well, we hope that this evening's program has been helpful and informative when it comes to the coronavirus. My advice to you is share this information and share the YouTube link with your friends and loved ones, and make sure that everyone is informed about what exactly to do when it comes to the coronavirus. What we'll do here at the SABC, as well as African Perspective, is that we'll continue to monitor the repatriation of South Africans who are in China, and you can join us next week. Thank you so much for watching. Goodbye.